HealthCare Partners, Tuesdays on Mornings with Patti. Hear the doctors, nurses, and other specialists at GRMC talk about the healthcare issues important to you and what GRMC can do to take care of you and your loved ones. They'll answer your questions and discuss the latest developments in the medical fields they specialize in. Keep it tuned to K-57 on Tuesday mornings at 9:35 to hear your HealthCare Partners on Mornings with Patti.
This week is your last chance to nominate your favorite local singers, dance groups, bands, and performers for the 2017 Island Music Awards. Log on to GuamIMA.com and get your favorites on the official ballots. The 2017 Island Music Awards is presented by Budweiser, the Agana Shopping Center, Bank of Guam, Playhouse Studios, the venue, and the Sorensen Media Group, with special thanks to Platinum Properties and Jamaican Grill.
Hafaday, Guam. If you suffer because of bad eyesight and you've thought about getting LASIK corrective surgery, now is the time to do something about it. Call Island Eye Specialists now to set up your free consultation. That's 637-2020. Get rid of your glasses and contacts forever. There are just a few time slots left, so call today to reserve your spot. And get a special discount if you have Calvo Select Care, Take Care, Stay Well, or Netcare Health Insurance. That's 637-2020.
Now, welcome back to the ending of our Tuesday programming. I will let you know that at some point after I get off the air, we are going to fix all of that static. We've sent out the true doctor for the tower today. They're finally going to do the connections that need to be connected after we took a lightning strike last week, almost 2 weeks ago. What is about a week now? So that has rendered us really crippled, and we apologize for the static, but that was sort of the order of the day for the past several days. And so today we've got somebody climbing the tower. They're going to go plug everything back in, and all should be good to go. So we'll go off the air sometime after 10 o'clock. I don't have the exact moment, but you can expect that we won't have some of that local programming. Instead, we'll bring you some live other mainland programs as we normally do in times of trouble with our tower. I want to say good morning and welcome to our friends at the Guam Regional Medical Center, where we are launching for the city, where we are launching for the very first time on my program, Your Healthcare Partners. This is a segment that we intend to run every Tuesday, featuring different professionals and specialists at GRMC, and we're starting off on our maiden voyage with the endocrinologist Dr. Ronald Innerfield. Good morning, sir. How are you?
Oh, fine, Patti. It's a pleasure to be here.
It's a pleasure to have you here. Now, how far away did you come?
I came from the New York City area.
Okay.
Yeah.
And how long were you in practice in New York?
More years than I care to admit.
Than you want to admit on the radio?
Right.
Well, it seems to me that we have been bringing a lot of this kind of specialty care from the mainland, which is something much different than what we've been doing in healthcare on Guam, where we would recruit from anywhere we can get them that they had the U.S. credentials in order to serve here. But we are attracting a lot of doctors from the actual U.S. mainland. And so I wanted to find out from you, when somebody put this offer to come to GRMC in little old Guam from New York City, or was it New York City or just from New York?
Yes, it was Long Island. Which
Long
is
Island, okay.
Yeah, just outside.
Yeah, so your point, when you looked at it going, Guam, what can I do there?
Yeah.
Would you mind just pulling up your
Sure,
microphone, Kevin?
sure.
Okay, there you go, thanks.
Okay.
So what was the attraction?
Well, actually, when my wife threw me out of the house about 12 or 13 years ago, I had an offer to give a lecture in Singapore. Mm-hmm. And they had me stay in Raffles Hotel, which was really nice, and I could bring my son along. And they gave me an extra week to go anywhere that I'd like. And actually I went to Phuket. Fell in love with Thailand and this whole part of the world. Every time I'd leave, I'd say, geez, I don't want to go home. I wish I could stay out here. But I don't speak Thai.
Yeah, well.
And, you need to speak Thai to be able to get the third part of the license out there. So as a consequence, I was just scanning my email one day, and I saw from a headhunter that they were looking for an endocrinologist in Guam.
How many of you are there, by
There's
the way?
4 of us here. and we're all well needed, believe me.
That's the second part of my question, but go ahead. So then you found an opportunity to come to Guam, what feels like land of diabetes, really.
Oh yes, it definitely is. There were the two things that really attracted me was one, the amount of diabetes here, and two, the fact that it's an island, and one of my dreams was to be able to get a sailboat and try to sail the mighty Pacific for a while. It's yet to be realized, but there's really plenty of diabetes here, more than I can really wrap my arms around.
And so that makes you make a strong point that there are 4 endocrinologists on Guam, which are much needed specialties in an area where diabetes is so prevalent. Is there not enough of an attraction to come here? Or, I mean, you go where diabetes is? I mean, how does that work?
Yeah, that's a good question. I think that, the problem is that it's a part of the United States. You need a United States license to practice here, and it's far away from the States. It takes a long time to get back there, and a lot of people are just afraid. And once they come out here, they love it, but
they're afraid they're not going to go back. Is that well? That's a bad problem to have, I guess.
Right.
But the thing about diabetes, though, and what we've seen is that there are enough people who have diabetes in America, and where is it on the list of diseases? You'd say.
Well,
top?
it's probably in the top 3, depending on how you categorize it.
Okay.
There's a new push to try to get people before they actually become overtly diabetic and have an elevation in their blood sugars. And that's to find some folks who have what we call pre-diabetes. And we used to call that impaired glucose tolerance or impaired fasting glucose. And these are people who are high risk for heart disease. And so that's why it's important to identify them. And there are probably 100 million folks in the entire United States that have pre-diabetes and diabetes, maybe even more. And on Guam, it's at least half the population, if we're going to include not only diabetes but this precursor.
Pre-diabetics, yeah.
Right.
And so if you're living on the mainland and you have diabetes, you might even have a better shot at it, no pun intended, but you definitely have a better shot at managing the disease than you might somewhere. This is sort of a question, than you might on Guam, where we are so far moved from some of the medicines, for example, that are available to us, and fetching some of the prices that they pay in the mainland by comparison.
Yeah, Patti, you've definitely hit a nerve there. If you practice endocrinology in the States, there are drug companies that are stepping over one another to get into your office and give you samples, give you samples not only of drugs but of glucose meters. You can hand them out to patients. They make their money mainly on strips, so they'll give you the monitors for free. The drugs, you get samples of all of the newer drugs and the coupons. But there's no representation of any of the drug companies here on Guam, so we have no access to that. As a consequence, if I want to get a patient a meter, the patient's got to come out of their pocket to get the meters, and the costs are prohibitive. I wanted to get a couple just for me in the office as a physician, and the costs for me as a physician to pay for these things myself was really prohibitive. There are lots of newer drugs that are out, and the newer drugs really help to address one of the primary problems that lies behind diabetes and heart disease, and that's obesity. So the newer drugs will be able to control your sugars but also help you to lose weight. The problem is that for most of the people on the island who have diabetes, these newer drugs are not covered by the insurance programs that are available. The Guam Medical Assistance Program, Medicaid, will not cover these drugs. One of the drugs you can get, but it's an act of God, really, to try to get these drugs approved. They're very expensive, and as I say, there's no drug companies that come over here and give you samples. So it really kind of ties your hands behind your back. So one of the things we're trying to do at GRMC is to institute some clinical trials. So at least half the folks that we put into our clinical trials will be able to get access to some of these drugs.
Have you seen these drugs work?
Yes, I've seen these drugs work, and these drugs have also just completed some huge trials to demonstrate that not only is there efficacy against lowering blood sugars, but there also is improvement in survival. So
then it would seem to me that if there's so much competition on the mainland to push these drugs, then why wouldn't they recognize that a population with more than half suffering from diabetes would not be a marketable place for them?
Every time I go back to the States and go to an endocrine group meeting, I try to meet with representatives of the pharmaceutical companies. I've made some specific trips to talk to pharmaceutical companies. The problem is that the way their marketing folks are reimbursed in the States is by the physician's use of their drugs. And it's very expensive for them to send people out here. So the problem that has been when I go to any one of a number of pharmaceutical companies is they'll tell me that we're not in their area. We're not in the United States area. We're not in the Philippine area. We're not in the Australia area. We're not in the Japanese area. We're always in one of the other areas. And
so in other words, there's no marketing representative in this region?
None.
Well, that makes kind of an interesting argument, doesn't it?
It does.
Because the mainland USA isn't where everybody. That's not the pot right there. Yeah.
And it costs the government a lot of money to take care of Medicaid and Medicare.
Well, we still battle over that one for sure here, but yeah.
Right. So you'd think there would be some incentive for the feds to try to reduce the onus, the burden, which is clearly reducible. There's all the folks who are on dialysis here on the island, or at least most of them who have diabetes and hypertension. These are all treatable phenomena, and we could reduce that to negligible amounts. There should be one dialysis center on island
instead of the number that we have. That's really interesting. And how do you intend in your practice and in your prominence at GRMC to push that? Can you make a louder protest, or is there a louder way to defend this?
I think it's coming on programs like yours, Patti, and trying to make everyone aware of the difficulties that we're having, not only in Guam but in the Marianas and Micronesia completely. We need to identify all the diabetics around. We need a program to do that. I've been saying that from really when I got on island, but as yet really have been unable to accomplish that. We need to know everybody who has family relatives who have type 2 diabetes.
What's the difficulty in that? I mean, they do have a number of nonprofit organizations and groups that have been formed in support of people with diabetes. Is it difficult to pull them all together?
It can be a little difficult. There is a group that's trying to do this. It's still up and still hasn't been accomplished. When you get committees together and large numbers of people.
Too many people have an opinion.
You're right.
And not enough chairs at the dinner table. Well, but is the reluctance by physicians themselves to put up a list, or is that in violation of any privacy laws, or what? No, not necessarily.
I don't think so. I think basically the physicians around the island want to do the same things that I want to do. And the problem is just that the costs of these drugs are so expensive that everybody gets put on drugs like sulfonylureas, which cause people to gain weight. These are drugs that have been used for 50 to 75 years. And really, we need to stop using this whole class of drugs for most of the folks with diabetes, and to utilize drugs which attempt to cause weight reduction, and thereby will improve their risks for heart disease, as well as what we call small vessel disease of eye, kidney, nerve problems.
Well, I appreciate the interest in this topic because, of course, there are, like you said, I mean, I didn't realize that the numbers were so staggering with, a little more than half of the population having diabetes. It must be frustrating to see what an end site looks like for the treatment and not having the kind of support that you need from either the drug companies or the government.
Yeah, one of my big pushes, and I'm a fairly conservative kind of guy. One of my big pushes, I think, that what this island really needs for most of the folks, and I've tried to get GRMC interested in doing this, and there is some interest, is to have a non-for-profit HMO-like facilities, so that instead of trying to treat people when they have the disease or when they have their problems, we now try to prevent these things from happening. And I think if all of the money could be put into a not-for-profit HMO, and we could have access to all the folks that have relatives with diabetes or overweight themselves, that we could do a much better job, and let us allocate, us in this not-for-profit HMO, let us allocate the costs for purchasing these drugs, or convince the governmental authorities that it's in their best interests to really allow for these drugs to come in. And the other thing that we need to do is, because these drugs are so expensive in we're part of the United States, is the drugs are much cheaper in the Philippines. A lot of folks go over there and get their drugs.
And a lot of times you go to the Philippines, you don't even need a prescription.
Right. Why can't we get our drugs? They're essentially made by the same kind of people. Mm-hmm. Why can't we get our drugs from there? Why do we spending so much money? And
why does the U.S. FDA not allow us to purchase drugs from foreign countries? Well, because they don't have a bridle on it. They don't have the bridle on the manufacturing. They don't have a bridle on the dosage, right? They don't.
Yeah, but a lot of if they're the same manufacturer, a lot of times,
I see what you're saying.
A lot of folks are getting drugs from Canada and trying to import drugs from other. And I think it would really help the overall. We in the United States, and here in Guam as well, as a consequence, are essentially paying for the low cost of drugs in Europe and in other parts of the world. We're subsidizing the rest of the world because we're paying full price. If we could get our drugs from these other countries, then the pharmaceutical companies would see that they'd have to raise the prices somewhere else to compensate for the business that they're losing from us.
Such as the relationship between pharmaceutical companies and the U.S. FDA?
No. There people. I used to work at the FDA, so I can tell you that there was some concern that this might happen because drug companies are now paying for their new drug applications. So there was a concern that the FDA was now going to be in the drug companies' pockets. The FDA really sits at a funny interface, the interface between politics and science. Mm-hmm. And sometimes politics wins, and sometimes science wins, and that pendulum kind of swings back and forth. But unfortunately, the paradigm is for allowing for less regulation, and the pharmaceutical companies are making most of their money, in point of fact, from folks in the United States and Japan as well. And it's really a shame if they allowed for opening up the borders, as it were. And I know our current president is somewhat reluctant to do that.
Yeah, absolutely. But and the point is that pharmaceutical companies, U.S. companies, have really no investment in starting up a facility somewhere like you'd say where the Philippines, because everything is so cheap there, and sometimes you really don't know what the quality of the medicines that you're getting. Mm-hmm. They also run the danger that you can buy at any drugstore penicillin, mm-hmm. Over the counter without and so then a lot of these are controlled drugs, controlled medicines that run the danger of people becoming immune to them if they buy them at a lower price and be able to bring them back.
Yeah. Well, you're kind of advocating for really a physician doorkeeper, as it were. Mm-hmm. And I think that makes a lot of sense. But the FDA has a generic drug division, and they decide when drugs
can become generic,
are safe enough, so that there's really no problem to do that. So.
It's a fascinating topic, and I'm so glad I got to meet you. I hope you'll come back one day if you get this group together. I'd like to see what a conservative guy that's soft-spoken can raise sort of hell on a topic like this.
Yeah, well, hopefully by the next time I come by, your lips to God's ears.
Well, wouldn't that be a miracle? Thank you so much, sir. It's a pleasure to meet you.
Thank you. Same
and you will meet many other doctors and others with services at the Guam Regional Medical City as a part of our new segment called Your HealthCare in Partners. This is part of the GRMC's outreach in order to find patients that are partners. Thank you very much for the time.